Parents and pediatricians cannot find the new COVID vaccines for their kids due to some distribution delays, shortages at pharmacies, and financial obstacles confronting pediatric practices. The new shot is recommended for anyone 6 months and older, but the federal government is no longer responsible for buying and distributing the vaccines. Here to talk more about it, Dr. Timothy Quinn, family physician and board-certified obesity specialist. Well, this is concerning. I want to get my kid the shot. I show up, it's not available. What's being done to address this?
Well, there's a lot of conversation, but what I want to stress is the importance. Right now, COVID is on the rise. We actually just discharged a patient from the clinic literally 10 minutes ago that had a positive COVID infection. And the deal is the vaccine is so much more effective for this new strain. And so important they get this new vaccine because children, especially children, they're less likely to follow those mitigated strategies. Children are less likely to wear the mask, they're less likely to social distance, and the new vaccine is better able to protect us against these new variants. So if a child comes into contact with another child, and our children are back in school, the child has a higher chance of getting sick, possibly losing his life, hospitalized, but also if the child is fortunate enough not to get severely ill, if they contract COVID, they can still serve as a carrier. And if they have a family member, say they're elderly on chronic medical conditions, their immune system is compromised, that individual could lose their life. So it's so important that these manufacturers work with these distributors and get these vaccines out to the general public.
Right, and then the availability concerns. So your message for parents, if they go one place and it's not available, and do you see the shortage ending soon as we head into the cold winter months?
Most definitely. Just keep trying. I mean, there are a lot of reports out that, these manufacturers, they're working hard to get it out, but don't give up because these new strains of the COVID virus, it's more infectious, meaning if you come in contact with someone, there's a higher chance that you'll contract COVID. And we just have to remember, especially for our children, they're less likely to wear those masks and social distance, and they're in those schools in close quarters. That's why it's so important that we get these children vaccinated as soon as possible.
This is concerning. STDs have been on the rise. Record levels we're seeing in some areas. Health officials do have a plan to reduce the number of STDs among gay and bisexual men using an antibiotic called doxycycline. It's been taken within 3 days of unprotected sex. It makes it far less likely to get things like chlamydia, syphilis, or gonorrhea. So it sounds like a morning after pill, essentially.
I mean, this is very exciting. I mean, right now, as you said, STDs, they are on the rise, throughout the United States of America. And basically, this was a proposal by the FDA. And this proposal was that, individuals could have access to this antibiotic. This antibiotic, doxycycline, has been around for over 40 years, and it's safe. And basically, they looked at research, fact-based, documented research. And even one article was listed in the New England Journal of Medicine. And in this research, the finding was individuals, and they looked at individuals that were high risk, bisexual and homosexual men. If they received the doxycycline, there was a 90% decrease in the chance that they would contract chlamydia, an 80% decrease in the chance that they would contract syphilis, and greater than a 50% chance that they would contract gonorrhea. So this is really encouraging because anything that we can do to decrease the infection rate in America is much needed right now.
Right, drive down those numbers. Finally, Doctor, nearly 40% of Americans with type 1 diabetes are not diagnosed with the blood sugar condition until they're at least 30, and that squashes the longtime belief that we've all heard that it's a childhood disease. The CDC says that type 1 diabetes symptoms are often initially mild. They may go unnoticed for months, even years. Does this new data and research indicate we need to change how we look at screening?
Most definitely.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.